Not to the police, not to emergency services, but to a closed radio station in northern Spain that had been off air for almost 6 years. The phone rang exactly 7 times before the voicemail picked up. What was recorded during those 23 seconds would later become one of the most disturbing crime mysteries Spain never officially acknowledged. The voice was calm, male, mid-30s according to analysts, no accent strong enough to trace. He said only one sentence: "Check the river behind San Telmo Hospital at sunrise. I kept my promise." Then the line went dead. At 6:42 a.m., a maintenance worker walking near the river noticed something caught between reeds. At first, he thought it was a mannequin, until the water moved. The body belonged to a woman in her early 20s. No visible injuries, no signs of struggle. Her hands were clean, her clothes neatly arranged. But her eyes were open, staring directly upward, as if she had been placed there carefully, deliberately. This was not a crime of rage. It was a crime of precision. Her name was Marta Iniguez, a nursing student, no criminal history, no enemies, no suspicious relationships. She had left her apartment the previous evening to buy medicine and never returned. The autopsy revealed something strange. There was no water in her lungs. She hadn't drowned. There were no drugs in her system, no blunt force trauma. The cause of death was listed as acute respiratory failure, but doctors quietly admitted it didn't make sense. 3 days later, the radio station's voicemail rang again. Same voice, same calm tone. "I told you where to look. The next one will teach you how." Police sealed the station and traced the call. It led nowhere. Disposable phone, no fingerprints, no pattern except one detail no one noticed at first. Every call came exactly at 2:11 a.m. Investigators began digging into Marta's life, but everything pointed to normalcy. Then a junior detective noticed something odd in hospital records. Marta had volunteered briefly at San Telmo Hospital 6 months earlier, not as a nurse, but as a patient observer in the respiratory ward. So had the second victim. Her name was Lucia Ferrer, found 5 days later in an abandoned bus stop on the outskirts of the city. Sitting upright, no blood, no marks. Her death mirrored Marta's exactly. Acute respiratory failure. No explanation. The voicemail came again that night. Patterns are easy to miss when you don't want to see them. That was when police realized this wasn't random. This was a message. Both victims had one thing in common beyond the hospital. 2 years earlier, they had been witnesses in a quiet internal investigation involving a respiratory therapist named Daniel Rojo. Daniel Rojo had been dismissed from San Telmo Hospital after 3 patients died during overnight oxygen therapy sessions. Officially, it was listed as equipment failure. Unofficially, Daniel had warned the administration repeatedly about a defect in a new oxygen regulation system. His reports were ignored. When deaths occurred, the hospital blamed him. Daniel was fired. The investigation was buried. The witnesses were reassigned. Life moved on. Except for Daniel. What police never found was Daniel Rojo. No employment records, no bank activity, no social media. It was as if he had evaporated. The third victim was found in her own bed. No forced entry, no signs of struggle. Windows locked from inside. Her phone placed neatly on the bedside table, open to a voicemail app. The timestamp read 2:11 a.m. She was another witness. This time, panic spread. Media caught wind. Authorities denied any connection. But the voice returned one final time. "I didn't kill them. I corrected the outcome." That sentence changed everything. A forensic specialist re-examined the bodies and noticed a microscopic detail previously overlooked. Each victim had faint pressure marks behind the jawline, consistent with a specific medical technique used to restrict airflow temporarily, without leaving bruises. A technique taught only to respiratory therapists. Daniel Rojo hadn't killed them violently. He had recreated the exact conditions under which the original patients had died, the deaths that had been blamed on him. This wasn't murder in his mind. It was demonstration. Police believed Daniel was trying to force a reopened investigation, but they were wrong, because the calls stopped. No fourth victim, no confession, no arrest. Months later, during renovations at San Telmo Hospital, workers discovered something hidden behind a sealed maintenance door in the old respiratory ward. A small room, a chair, medical notes pinned to the wall, dates, times, and one final sentence written in red marker. Truth doesn't need witnesses. Daniel Rojo was never found. The hospital quietly settled with the victims' families. The original investigation was reopened and closed again within weeks. Officially, the case remains unsolved. Unofficially, some investigators believe Daniel achieved exactly what he wanted. Not justice, not revenge, but silence. Because after that case, no hospital in the region ever ignored a safety report again. And every year on the same date, at exactly 2:11 a.m., the disconnected phone line at the old radio station still rings.